Hi there, I'm Roisin Clenahan Johnson, and I'm here to talk to you today about the Care Kit. The Care Kit is a program that has been in Richmond for quite a long time, and I've been teaching it, I think, since the early 90s, or mid-90s. It's been a while. I introduce the parents to this kit in a very sort of gentle way, giving them an information sheet that goes home to the families, and it talks about the different cards and introduces each one very generally. And when I speak to the parents in the hallway, I usually tell them how we'll be starting it in a couple of weeks, and that it's just another thing that we teach the students, just like we do fire drills and earthquake drills. We do the Care Kit to give the children more tools to help them to be safe and to learn some new skills on being empowered and being conscious of what they think is right and wrong. Overall it's gone quite well with the parents. I haven't had too many people with concerns. I have not even ever had a parent come in and ask me to see the cards and explain the program to them, so it's okay, it's not too scary. Usually when I'm teaching this, because it's a program that will be new to you, that's the reason why it comes in a kit like this with the cards. And I know that the cards aren't normally something that we would use as a teaching tool. We usually learn our topic and then teach it, but using the card really helps you. It's a good prop. It makes sure that we give the specific and particular information to the students, as opposed to generally learning it and then not having a consistent way of delivering the message. And the fact that we in kindergarten start with the Care Kit and then the children learn it again during the primary years, the spiral learning helps them to actually catch the things that they didn't get the first time or reinforce them. So that's helpful. I think when you are teaching a new kit and a new thing that's unfamiliar to you, it's a good way of having all the information there in front of you. You don't have to go and look for resources and materials. What you need is right here. And I find the cards themselves are quite self-explanatory. They're really good about showing you the same picture on the back that they have on the front and giving you specific words that you should use and reinforce with the children, questions, and it really directs the lesson for you. It's quite helpful and makes it an ease of teaching. So I appreciate that. Along with the kit comes a little puppet, and I find that the children really enjoy the puppet. You can name him yourself, and the children enjoy playing with him. I'll leave him out during other times, and at center times they sometimes like to play with him as well and incorporate him to other aspects of the class lessons that we're doing, so it's quite cute. That, I think, really helps to bring in the children's attention and sets this aside as a different time and a different kind of activity than what we would normally do. I think that to prepare the students for the lesson, I always make sure that I do it before a natural break. I do it either just before lunch or just before the end of the day, and we come together on the carpet, we sit down, we're quiet, I bring out the materials, and that way they know that it is time for the Care Kit. We talk about being responsible and being a good listener and putting up our hand and hearing what other people have to say, because it's different and unusual maybe for some of the children, and sometimes might be a little stressful, some of the topics that they talk about. We try and stay on topic, because we know kindergarten sometimes share things that are not anything to do with what we're learning, but we talk about how it's important to think about what we're doing in the Care Kit, and that that's what we're talking about at this time. We make sure that it's low-key and quiet, and that they've had some activity beforehand so that they're not restless and sitting on the carpet for too long. So usually I spend about 20 to 25 minutes on a lesson, and sometimes I find that if you're using a message card and then you have the discussion card after and it's taking a longer time than you anticipated, it's okay to stop at the end of the discussion card and continue with more of that the next day. I would just review the message card and then quickly go through the other discussion cards, because some lessons have quite a few discussion cards. So, as I said before, the kindergarten teacher is generally the one who's introducing the students to the Care Kit and getting them their initial exposure to it. After that, the children will learn it again in another grade, so they'll be more familiar with the concepts that you covered. So one of the things, of course, when we come to the dreaded message card too, when we talk about the body parts, I really focus on them being a body scientist and using the term that you are a body scientist and you learn proper names for things so that you can be informed and so that you can speak correctly about your body parts. And they tend to think that that's quite neat, that they're scientists. So I haven't really had any difficulties or challenges. I haven't had any disclosures from students in all the years that I've done it, but I think that it's good to arm them with the tools that they need in case they do have something like that later on. I think that it's a good way of delivering a consistent message to the students, having the kit and using the cards, and it's, I think it makes it easier for us because we then know exactly what we need to cover, and then we can do our lessons. So that's it. Thank you for listening.